brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, everybody, we are back, and this is Healthy Living Tuesday right here on KU News Extra. Dr. Jitka Lom continues to be with us today, educating us and edificating us on the topic of acne and, generally speaking, dermatology to some degree.
Yep.
All right, so here we are with our viewer questions. You ready to go?
Yes.
All right, so our first question, gentleman in the back, if you would, thank you very much, comes from the Southern Village of Agate. This comes from Timothy S., and he says something that we touched on in the first block. Does your diet play a role in your acne?
It actually does. Societies where they do not eat a lot of processed foods do not have as much acne. If you eat a lot of high fructose corn syrup or foods with a high carbohydrate content, such as donuts, fried foods, chocolate, French fries, all kinds of fried foods, those are going to aggravate your acne because they increase the amount of sebum that you will produce. Milk also seems to have an adverse effect for some people.
And on Guam, I would say that's kind of a tall order to fill, or that.
Yeah, it's a typical teenager's diet,
There you go.
Soda, chips, fried foods, chocolate, and cookies.
Okay, well, we will get to our next question in a moment. There's a little bit of a street medicine that, again, with the urban myths. How safe is it to pop your pimples?
Well,
that's crazy.
Yeah, it's really not a good idea because you're going to cause scarring. That's the most unfortunate side effect of that. But if you think of it, it's inflammation with bacteria inside that's contained in that pimple, in that zit. You pop it, you've just spread that all over the rest of your face, so any other pores that were not contaminated now will have more germs in them. So it's really not a very good way of handling your problem.
Okay, well, you heard it, ladies and gentlemen, from the doctor herself. Do not pop your pimples. All right, here we go to our next viewer question. This one comes from the north. This is Cynthia L. from Jigo. She says, Doctor, my skin is itchy after I apply benzoyl peroxide. Is that normal?
Yeah, benzoyl peroxide is one of the most common drying agents that you can use. It's available over the counter in strengths of 2.5% up to 10%. So I'm not sure what strength she's using, but she might back off and use the lower dose, lower strength, 2.5%, and use it sparingly. Moisturize after using a nice lotion to help with the dryness. But about 5% or so of patients will be allergic to benzoyl peroxide, and they won't be able to use it. They'll just get too red and itchy. Okay,
but under normal conditions is like a little bit of itchiness, a little bit of dryness, that's okay?
Yeah, that's a good sign. That means that you're drying it up.
Okay, all right, good tip. Okay, our third question comes from Agana Heights, and Norma B. asked Dr. Lom, I heard that some birth control controls acne. Is this true?
It is true because, again, it will modify the hormonal environment that is present in the skin and the amount of androgen. When we talk about androgen, that's the male hormones. The most common one that you'd hear about is testosterone. When you have more of that in your skin, you will have more acne. So the birth control pills can help.
But typically, how far along to someone's diagnosis and everything would you as a physician say, okay, well, we're going to go away from maybe, like some of the proactive and some of the over-the-counter stuff and everything, and, you might want to try birth control?
Well, I'll ask them if their menstrual periods are regular. If they're irregular, then there's a good chance that their hormones are having an effect there, and they may consider going on that medication in order to regulate their hormones a bit and improve their acne. So it would just be part of the regular history that I take.
Okay. All right, we have another question. This one comes from Paul. He is from the village of Manina. Now he says, evidently he's an older person because he says, I never had acne as a teenager. Doctor, why am I getting acne now as an adult?
Yeah, that's frustrating, isn't it? But we have to think about what are the different factors. First of all, some men go and work out and they use steroids, to bulk up more. So we want to make sure he's not using that, or topical steroids on his face, because that'll make you get acne in an older age group. Also, some occupations, if he's working with a lot of oil, and it may be a mechanic, that kind of thing, it can cause acne to break out. And his diet may be having a factor as well. So quite a few little things to think about there, but even if he's in his 40s, we can still control the acne with the standard therapy.
Okay.
Yeah.
Now, I've also read that like some people as they get older, whereas maybe when they were younger they got pimples or blackheads like on their face, and sometimes they get it like on the inside of their nose now, or maybe some other places that they didn't before. Is that just part of the normal aging cycle, or is that just more lifestyle related?
It could be lifestyle, again, diet related, but we have to think about some other things that it might be besides acne. It might look like acne, but actually not be acne. For example, a contact dermatitis, meaning an irritation from, let's say they're wearing a mask at work, that can cause an acne-like eruption where it will look like it, but it's not really. Also, quite commonly on Guam, I'll be seeing a yeast infection on the face or chest called pityrosporum. We see that a lot because people perspire so much here, and it can look a lot like acne, but it's not. And then a funny, interesting little thing is that toothpaste can also cause acne around the face, around the mouth, because many toothpastes contain fluoride, and when it's on the inside of your mouth, the fluoride can be converted into a steroid.
Really?
Yeah, and again give you an acne breakout. So you could choose to go with a non-fluoride toothpaste for a while to calm it down.
I was not aware of that. That's pretty remarkable.
Yeah.
Okay, so we'll go ahead and close with this last one. Of course, one of the things we like to do here, at KUM is, we review products from now on. And one of the products that came out, I think it was in the 90s, was the Biore strips.
Right.
Okay, as a professional doctor and everything, what's your opinion on, that? Because, so many people swear by it and they rave by it.
Anything that removes the oil from your face, if it's a blotting strip or a Biore, or if it's a scrub, anything that removes oil and debris from your face is going to be helpful.
All
So
right.
not a bad thing to try.
Okay, well, doctor, thank you so much once again.
Thank
We'll see you
you.
next week.
Yep, thank
All
you.
right. Okay, so we will see you again next week, everybody there. Now, Dr. Lom will discuss hot flashes and menopause during next Tuesday's episode of Healthy Living right here on KUM News Extra. So if you have a question, make sure to post it on our Facebook wall at KUM.com/Facebook, and we will feature it right here. Once again, hot flashes on menopause. That is next Tuesday.